because not only my protocol for full arch treatment is fully digital, but also in minor cases, it helps us to communicate with the lab, which not only shortens the time of the treatment, also makes the mistakes less, but also saves the patient time and gives us more accurate and beautiful outcome. First of all, of course, accuracy. Then being able to plan the proper walks-up before the treatment that we can really not only promise but also execute, so deliver to the patient, and also to have a perfect communication with our lab technicians. It gives you accuracy, it gives you the freedom to create, and it saves your time and also allows you to have a better connection with the lab. So if you haven't by any chance tried to go digital yet, you definitely need to do that.